At the same time, the COVID-19 vaccination program will soon be extended to anyone over the age of 18. But undocumented immigrants, as well as homeless South Africans, find themselves left out. To discuss the fate of migrants and asylum seekers, let's welcome Amir Sheikh, who is the spokesperson for the African Diaspora Forum, joining me now for that conversation. So we had been given the undertaking when Zweli Mkhize was still the health minister, Amir, that the migrants that live in South Africa would not be left out because it simply would not make sense to leave anyone out of the massive vaccination program. But what is the reality on the ground for those who are documented and those who are not documented?
Thank you very much, Tulasiswe. To be sincere, the former minister, Dr. Zweli Mkhize, made it very clear that the vaccine will be rolled out to each and every person, and no one will be actually left behind. And the message of the president was also an inclusive one. But the problem where we see there is a red tape is actually the vaccine database that have been created that doesn't accommodate the undocumented person. And it is very difficult actually for someone who have got no document at all, a segment within the community that are also not privileged actually to have medical aid to go to actually register themselves. We have also seen some of our members who are not documented, or whose documentation have expired, also turned away and actually told that, you know, they only need to come with a document that is not expired for them to be actually assisted, considering the fact that also the refugee reception centers across the country are closed actually since the introduction of hard lockdown almost 2 years ago by the president.
That doesn't make sense, does it, Amir, that people would be turned away simply because there are documentation such as the asylum seeker documents, for example, would have been expired within this period of COVID-19 and the lockdowns, with the announcements made from time to time that those expired documents are considered as valid given the situation that we are facing. So for people to then not be able to access services based on those documents that are de facto extended doesn't make sense.
Truly it doesn't make sense, but this is actually the reality of the migrant in South Africa, whether you are documented or not documented. And the way the wordings comes from actually the top, when it comes to the bottom down, at the implementing level, you will still be remaining a foreigner, and your documentation, irrespective of whether it is actually right, whether it is actually expired or not expired, will not make sense. And we are seeing the same implementation also as the centers that actually people are getting their vaccination rollout. And the amnesty that have been given by the minister, or actually the extension through online, is very valid. They have got the right to actually verify the documentation, but it's unfortunate. This is institutionalized type of xenophobia, and this is something migrants have been experiencing for many years, and now we've seen it also rolled out and experienced in centers that are actually giving this vaccination. It is very unfortunate to vaccinate one segment of the community and left another behind, because it will not serve the purpose of the vaccination rollout.
So have you tried to raise this issue and bring it to the attention of the relevant authorities, the health MECs and, the minister as well? And what response are you getting from them?
Unfortunately, we haven't gone to actually the ministers or the MEC in the respective province, but we need actually to upload very progressive provinces like Western Cape that have made documentation to undocumented migrants, so that they can get their vaccines. And we think other provinces will replicate this. We have seen also concern from local communities actually in Limpopo, in Northwest, that have came out and stood and said that, you know, irrespective of your documentation, your color and creed and country of origin, COVID affect all of us, and for us to be safe and immune from these viruses, each and every person need to be documented. Because the message by the president or the minister was an inclusive one, and it did not leave anyone based on his color, his actually creed. But what we have also done in areas that are dominated by migrants, we made also inroad to go and actually meet the official who are administering the job, and many of them were very helpful. and with recent announcement recently that even the documented will get, we will follow this. And if we see there is no joy by Monday, then we have no option but to write to the current minister, Dr. Pala, and also to the respective MECs in the provinces.
Yeah, lastly, Amir, why does this matter? Just underscore for us what the implications are of leaving out segments of a population within South Africa from this vaccination drive. If we don't get this right, what are the consequences?
The consequences will be actually very dire, because once you actually, okay, the migrant community, the vast majority of them are not medical aid carriers. These are actually people who have lived and coexist with the poorest of the poor within the community. Their children attend the same school with them. They stay in the same clinic. They attend also every aspect of life together. So if one segment, which is South African, the other segment is not also vaccinated, then the problem will still be actually there. And we do not foresee actually where we will be excluded because we are undocumented or documented or foreigner. But this is institutionalized xenophobia. We have experienced for long and we lived with it. And at least we will try our best, but we hope at least they will adhere to the call of the president and the minister, and nobody will be actually left, because this virus affects all of us. And one segment getting vaccinated and another, it's still not going to help the process of vaccinating the whole nation.
Yeah, all right. I've got to thank you for your time there, Amir Sheikh, who is the spokesperson for the African Diaspora Forum. I guess the bottom line really is that we are not safe until we are all safe, right? The virus will continue to circulate in high numbers in our society for as long as there's a large number of people who are not vaccinated. And if you're living out segments of the population, documented, undocumented, if you're living out people, they still are susceptible to contracting the virus and actually putting a burden on the healthcare system. So that's really the nub of it from that conversation with Amir Sheikh.